Comparing 3-drug lethal injection and 1-drug lethal injection. Examination of decision-making in botched lethal injection executions in Texas. The objectives of this article are: drug shortage have led to compounding pharmacies as the primary suppliers of lethal injection drugs. This has caused Texas to change execution protocols. Explore differences in length of time the lethal injection took and complications. 3-drug protocol and 1-drug protocol. Identifying the prevalence of botched executions with those 2 protocols. Did the switch in protocols put inmates at risk of pain? Box executions. What is a box execution? It's executions involving unanticipated problems or delays that cause at least arguably unnecessary agony for the prisoner, or that reflect gross incompetence of executioner. This article goes over research on box executions from 1982 to 2014. During those years, 40% were lethal injections, 31% were lethal gassings, 18% were hangings, 11% were executions, and there was 0% that was firing squad. The lethal injection had the highest rate of box executions. However, often people view it as being the most humane way to execute. 28 states and the federal government use lethal injection as their method of execution. Is lethal injection constitutional? The U.S. Supreme Court addresses this issue.
Since 2001, Georgia has used the method of lethal injection to execute prisoners sentenced to death. From the moment an Oklahoma medical examiner created the first lethal injection cocktail of 3 drugs in 1977, the moral and ethical concerns over how prisoners are executed have not subsided. And as several states, including Georgia, have switched over the years from a 3-drug procedure to a 1-drug procedure, questions continue. So, how do they work? The 3-drug protocol begins with a fast-moving anesthetic to render the person unconscious. Initially, that was the barbiturate sodium thiopental. That drug is no longer available in the United States for executions, so it has been replaced with the barbiturate pentobarbital. In a clinical setting, pentobarbital has been given gradually to stop a seizure. The second drug is pancuronium bromide, which surgeons use to effectively paralyze voluntary muscles all over the body, like the eyelids, biceps, and abdominal muscles, so they don't move during surgery. In an execution, pancuronium bromide is given in a dosage high enough to stop not only those muscles, but also the lungs and diaphragm. The third drug is potassium chloride. Doctors use it to treat people with dangerously low potassium levels, which can cause the heart muscles to malfunction. For executions, potassium chloride is given in a dose strong enough to stop the heart completely. All of these drugs are followed by a flush of saline solution to speed the flow of the drugs through the body. With the 1-drug method, which Georgia now uses, the sole drug, according to the state, is pentobarbital. In a clinical setting, pentobarbital is given gradually until it stops a seizure. In executions, pentobarbital causes the eyelids to close within seconds. The neurons in the brain stop firing. That then makes the chest wall stop moving, the lungs stop breathing, blood vessels to dilate, and the heart muscles to weaken until the entire cardiovascular system shuts down. So, what happens if any of the drugs fail to work as planned? Visit myajc.com to find out.
In the court case Bees versus Rees, 2008, the court ruled a state is not required to change its capital punishment protocol unless the petitioner identifies an alternative procedure that is feasible, readily implemented, and significantly reduces a substantial risk of severe pain. In Glossop versus Gross, 2015, the court cited Bays versus Rees, 2008, as a precedent stating Eighth Amendment claims require identification of an available alternative method of execution that entails a lesser risk of pain. In the court case Bucklew versus Preside, 2019, the court reiterated claims alleging the infliction of unconstitutional cruel pain must meet the Bayes-Glossop test. In 2020, the court rejected an appeal by death row inmates from the U.S. Court of Appeals for the D.C. Circuit, which ruled the execution protocol used by the federal government could differ from that of the state in which the prisoner was sentenced. And that court case was Bourgeois versus Barr, 2020. Drug supply and compounding pharmacies. Companies have stopped supplying states with the drugs needed for lethal injections. They've had to get foreign suppliers to follow suit. States have been forced to change the number and types of drugs used in their protocols. They've had to find new suppliers. They have to use different pharmacies to get the drugs. And it's hard to regulate the state and pharmacies' drug usage. Several states have continually changed their lethal injection protocols during this time the Supreme Court rendered its decisions. Drug shortage have led to the rise of compounding pharmacies as the primary suppliers of lethal injection drugs. Drug supply and compounding pharmacies. In 2009, Hospira Inc., the only U.S. manufacturer of sodium thiopental, stopped production. However, Hospira planned on continuing to manufacture the drug in Italy. Italian government officials threatened litigation if the company's sodium thiopental ended up being used in lethal injection procedures. This caused Hospira to stop all of their production. Drug supply and compounding pharmacies. Death penalty states sought out international suppliers. Those suppliers opposed the distressing misuse of its products in capital punishment. Danish manufacturers stated that they would no longer fulfill U.S. orders and had to sign an agreement that their production wasn't going to be used in capital punishment. Shortage with the foreign and domestic manufacturers caused an increase in compounding pharmacies. Drugs were being altered to obtain what was needed for the lethal injection. Drug supply and compounding pharmacies. Given lax regulations at the state level, small-scale compounding pharmacies have become attractive options for prison officials seeking lethal injection drugs. In 2013, Texas obtained 8 2.5 grams vials of pentobarbital from the Woodlands Compounding Pharmacy near Houston. After the name of the pharmacy was made public, the owner asked the Texas Department of Criminal Justice, TDCJ, to return the drugs. And then in 2015, TDCJ sent 80 grams to a pharmacy, and to this day, it's still unidentified. Altering drugs can include putting medicine that usually comes in a pill form into a liquid form, or removing inactive ingredients that may trigger allergic reactions. Large-scale manufacturers must register as an outsourcing facilities and comply with FDA regulations, and small-scale manufacturers are still regulated through the state. Execution protocols and decision-making. From December 7, 1982 to February 22, 2011, Texas employed a 3-drug protocol to execute 466 death row inmates. Sodium thiopental is a fast-acting barbiturate sedative that induces unconsciousness. Pancuronium bromide is a paralytic agent that inhibits muscular skeletal movements and paralyzes the diaphragm, ultimately stopping respiration. Potassium chloride induces cardiac arrest by interfering with the electrical signals that stimulate the contractions of the heart. Execution protocols and decision making. The Supreme Court upheld the protocol in Bays v. Reeves 2008, concluding that the petitioners have not carried their burden of showing that the risk of pain from maladministration of a concededly humane lethal injection protocol and the failure to adopt untried and untested alternatives constitute cruel and unusual punishment. Claims brought by Texas inmates concerning the constitutionality of the state's 3-drug protocol have also been unsuccessful. Execution protocols and decision making. Texas was forced to change its execution protocol in 2011 after Hesperia ceased all production of sodium thiopental. Texas replaced sodium thiopental with pentobarbital. Pentobarbital is a barbiturate sedative similar to sodium thiopental used to induce unconsciousness. This method was used in 16 executions from May 3, 2011 until April 26, 2012. In 2012, Texas's supply of the second drug in its 3-drug cocktail, pancuronium bromide, expired. Texas had to change their protocol again due to the manufacturers prohibiting states from using their drugs in executions and the FDA banning importation from foreign sources. Execution protocols and decision making. July 18, 2012, Texas adopted a 1-drug protocol using only pentobarbital, an alternative that's still being used. Pentobarbital shuts down the respiratory center of the brain and the diaphragm no longer contracts, resulting in death by asphyxiation. The 1-drug method is also preferred over the 3-drug method by veterinarians for euthanizing animals because the 1-drug method is more humane and less prone to error. 1-drug protocol poses fewer risks than the 3-drug cocktail. Data and method. There were 553 executions in Texas between December 7, 1982 to February 6, 2020. 466 were executed with a 3-drug cocktail, while 87 were executed with a 1-drug cocktail. The prevalence of symptoms is higher for those receiving pentobarbital alone compared to those receiving the 3 drugs. The 3-drug cocktail took average 9 minutes to execute, while the 1-drug protocol took average of 19 minutes to execute. Data and method. Specific complications under the different protocols. Higher percentage of individuals experienced complications with the one drug cocktail. They felt burning, hurting, or stinging during the execution. Fewer individuals had no complications when given only pentobarbital, and more experienced between 1 and 3 complications. 19.5% of inmates experienced at least one complication when only pentobarbital was used. They felt burning, hurting, stinging, and feeling the drugs were more common when an inmate was executed using the one drug protocol. 5.8% of inmates experienced one complication using the 3 drug cocktail. Conclusion. Texas used 2 methods to lethal injection executions: 3 drug lethal injection protocol and the 1 drug lethal injection protocol. Many pharmacies did not want their drugs to be used for lethal injection, which caused compounding pharmacies. There is a higher rate of botched executions under the 1 drug protocol.